Good morning and welcome to Backyard and Beyond. This morning our guest is Denise Coder, and she is Community Health Coordinator for Home Health Care. Good morning to you, Denise.
Good morning.
Well, Denise, you're involved with a lot of things related to health, obviously, but one of the things that you like to have people do is to get moving, and sometimes that's not the easiest thing to do.
Well, there are a lot of barriers to why someone might choose to not be physically active, but right now we're focusing on walkability in our community, and specifically walkability for our youth walking to and from school or biking to and from school, because the same kinds of routes are used. So we're undergoing a project called the iWalk Project, and it's including Schuler Elementary specifically here, so school partners, public health, so the Iowa Department of Public Health, as well as Cass County's Public Health Department, which is Cass County Home Care, and then finally Iowa State University Extension is partnering with us.
Okay. Is this a new project? I mean, is this something that's never been tried, or is this something that other towns are going through?
There's several locations in Iowa that are doing this, and nationally there's a very large federal project called Safe Routes to School. But in order to prepare communities to kind of decide whether they need increased resources from the federal government, the iWalk project is designed to do just that, to kind of take that assessment of your community to see where you're at, what your needs are. Do we even know how many kids are walking to school? Do we know that there's a need to get more? So that's what the goal is with this.
Mm-hmm. And when you say kids, of course, I see a lot more people out walking of all ages. It's not just young people. There are a lot of older people that are out there walking too. So they can benefit from this also.
You bet. And I think that's a great collateral benefit. Like you said, it's improving the walkability for everyone. So last fall, we actually did that initial assessment. We have the teachers do a tally every day for a week of how the kids got to school. We know from that about 30% or so of kids are getting to school by either walking or biking, and about 45% of kids from Schuler Elementary are getting home from school by either walking or biking. But we also know from the data that there's a lot more opportunity out there. And when you think about the benefits of getting more kids walking to school, obviously those kids themselves get activity for the day, and for some that may be the only activity they get. The teachers tell us that the kids arrive to school more prepared to learn. They've gotten that busyness out of their system, and they come and they're fresh and they're bright and they're ready to go. And then obviously the traffic issue, lots of kids get dropped off in vehicles, and so the more kids that you have walking, the less vehicles that kind of confound that traffic situation at those school locations. So maybe being able to reduce some of that traffic congestion at the school buildings too.
Now, over the past few years, there has been a walk to school time, spring and fall. And do you think that's made a difference? You know, as I looked at some of those figures, Atlantic had a little higher number that were walking and biking.
Well, we believe so. We've never really done a teacher tally like this other times of the year to know whether kids are necessarily walking or not walking. From the crossing guard comments, we believe that probably there are additional kids walking during our walk to school program when we actually have adults walking with the kids on specified routes. We have 4 routes in Atlantic that's occurring in, and we have also routes in other school locations throughout the county. But so yeah, I hope so. And the goal here with iWalk is to really further remove any barriers. Now, one barrier that a parent might have would be, I don't want my kindergartner walking unaccompanied to school. And that's one of the reasons that we do the Walk to School program in generally October and April. Generally, that's when we do it, just to kind of remove that barrier for parents. But we know that there's probably more barriers than that out there. And so one of the things that we're doing now is having parents of the 4th and 5th grade students complete an online survey for us to tell us in their own words, and through some phrased questions, of course, what barriers might be out there that we don't know about. We're asking parents to do that survey online, and these would be parents of the 4th and 5th grade children in Schuler, so not Washington or not the middle school. We're just targeting the Schuler building right now, to go online and complete that survey.
And that needs to be done right now, please.
Yeah, we attempted the survey earlier in December, actually. Didn't get a huge response rate, so we'd really love it if these parents would go on here in the next couple of days and get that done. The website address that you need to go to is www.i-walk.org. Very simple, just like it sounds. And And it should take about 10 or 15 minutes or so for the parents to go through that. So
And when you and I took a look at it, most of the questions are pretty straightforward. Yes, no, a few like you need your comment, but pretty straightforward. It shouldn't take much time to do this. And got to think about the benefits to everybody.
Yeah, not only your child, but you maybe, if you want to go on a bike ride with your child, getting those sidewalks in better shape or learning the better routes. So we're asking parents to do this, and then on March 23rd, we're going to do a GPS mapping event. And this is where Iowa State University and the Iowa Department of Public Health come into play. They'll bring out the GPS mapping units, and we'll actually go on some of the routes that were identified through the survey and check to see what barriers there are, document them with the units and that kind of thing. We'll be gathering later to decide if the funding that we're getting, if we could use some of that to make some improvements, or if we really need more resources than that, and what we might really need to make the whole community better for this process.
So parents of 4th and 5th graders in Schuler know that this information isn't just going out somewhere and not looked at. This is really important. This is going to determine what you look at in this project.
Yeah, and it kind of helps us allocate the limited funding we're getting. We're not getting a lot of money this year, but we're getting a little bit, and it could really make a difference in some of the walkability aspects of our community. So it is important. We have several people who volunteer to help us along the way, some parents, some students, some community volunteers, some people that work in various service agencies around the community. But if there's people out there we haven't reached that would like to participate with us in this process of mapping and determining what needs there are, you're welcome to give me a call. Love to add you to the list. The 23rd is our mapping date. We've got a morning session and an afternoon session, so it's not like you even have to commit for the whole day. And we'll cross our fingers that the weather's really nice.
But, this is kind of exciting. Anybody who's interested in the community, and especially if they're interested in walking and doing the GPS thing and all this, it's I think, a pretty exciting project, and you can be a part of it.
Well, and I think that's part of the beauty, is that there's no one individual or one agency that gets all the responsibility or whatever. Really, this is a community improvement process, and many entities will benefit. Families will benefit. The school will benefit with kids that are more ready to learn. Law enforcement will benefit with the traffic situation, and certainly in the big public health viewpoint, hopefully getting more people active and involved will benefit the health of our residents as well.
So good stuff all around. Now, we mentioned previously that Walk to School has been happening fall and spring. What about this spring? We're all ready for spring. It's not quite here, but what about plans for Walk to School?
Right now, we're planning on kicking off Walk to School on April 4th and going for the month of April. And again, in the past, we've had 4 routes established, and hopefully the iWalk project will help us determine whether those routes that we've established in the past are the best, to serve the needs of the community too. But in the past, we've had 4 routes established, and we have 2 volunteers on each route that walk the kids to school in the morning.
Okay. Now, that's 4 routes in Atlantic. What about other schools?
We do have routes in other districts. We have in the CAM district, we have both Messina and Anita routes occurring. We don't have anything established in Grizzle yet, but we're working on it.
Okay. So this opportunity, and I was surprised when this very first started. There is a national Walk to School day, but we do lots better than that. We do a month, not just a day.
I think it's in early October, and we tend to kick off our fall session with that a lot of times too. But yeah, it's a national effort, and it's probably really appropriate. When we were younger, lots of people walked to school, and a lot farther than just from in town. So we'd really like to get back to that process and get that daily activity a part of people's lives again.
Okay, so a couple of things to remember. March 2nd, you want a survey returned by who?
By parents of 4th and 5th graders that attend Schuler Elementary here in Atlantic.
Okay. And then on March 23rd, hoping the weather cooperates?
That's our GPS mapping event day, and if there's anybody out there that'd like to be involved, they can certainly give me a call at 243-7475.
Okay, and April 4th?
April 4th is the kickoff for Walk to School.
Okay. So lots of things going on. Just like I mentioned earlier, there's always a lot of great things going on, and I think this is a pretty exciting project. So thanks to you, Denise, and to all the many other people who are making this happen. It is a cooperative project. So thank you for your time, Denise Coder, who is the Community Health Coordinator for Home Health Care in Cass County. And until next time, here's a thought. Never point a finger where you've never lent a hand.